Dumelang South Africa, Sanbonani nonke. Welcome to the Health Club, the show where we take charge of our health one real conversation at a time. Ke nna Clement Manyatela, and this journey is proudly brought to you by GEMS, the Government Employees Medical Scheme, helping make healthcare more accessible and easier to understand for all South Africans. Lana Ku Health Club, we talk about health issues in a more relatable way. No jargon, no stress. We break it down so you can build yourself up. Should we be concerned as members of GEMS about this fraud?
Everybody should be concerned. If we could reduce the fraud, waste and abuse to a minimum. That would reflect in how the annual contributions are adjusted.
Counterfeit medicines account for more than 250,000 deaths in the SADC region alone.
Very often people think, well, it's a grudge purchase, I pay so much every month, so I can use these funds on anything.
Fraud, waste and abuse in the healthcare system are driving up costs and putting real pressure on honest members. It's a crisis that's closer to home than you think. Sem Mapalane is a former fraud and risk analyst for medical aids, and he's written a book about medical aid fraud and what he uncovered during his investigations. He says most people are guilty of some form of medical aid fraud. I mean, how many of us go to a doctor to ask for a doctor's note when we want a day off? Well, Sam says that is also a form of medical aid fraud. Here's more of what he had to say.
The HPCSA has got a GP board that regulates doctors, but it's doctors who are reported by the public, by the medical schemes, and then they have a setting and they must present themselves through their lawyers or in person, it doesn't matter. There ain't no such thing as a small fraud. It's a big fraud catched early. Because if you go back to fraud, you'll then start seeing, when it started, this was 2000. 2 months later, it became 4, it became 10, it became 15. So the sooner you catch it, although it will show as a small fraud, it's actually a good thing to have detection methods to say, catch it whilst it starts, because it will escalate to something much bigger. There's examples, many examples about members being part of the problem. Members being part of loaning out their medical scheme to people who are not on the card, but they will use the names of the people on the card in cahoots with either the secretary of the doctor or the doctor himself. Medical schemes now in April, they are going to start seeing what happened in January, because it's a 4-month cycle. After 4 months, you know that all the claims are in. It's a big problem. Annually, in January, the claims are high. Either last year the claims were not paid, they are reprocessed, or people are starting to use the medical aid as a bank. The HPCSA has got a GP board that regulates doctors. So the person who reported waits forever, you find that the person is fined 10,000 for 100,000 fraud. You also legally within the scheme, you stop doing business with them. You don't pay them directly. You choose to pay the members because you feel, we've spoken to you. You're not doing what is right. We'll still do business with you, but it will inconvenience you a bit because now we pay your members, then the members must pay you. You need to know what you're doing. Everything that goes to the medical scheme is your responsibility as the owner. Because some of these businesses, they are not set up like in a CIPC where you set up a PTY. When you say, I'm Dr. So-and-so, that's your business, it's you. The advice we always give from the fraud side is that you know when you went to the doctor, you know what happened, you know what they're gonna charge you. When you leave, you already ask those questions.
Welcome back to the Health Club. Before the break, we introduced an urgent conversation about something affecting all of us: fraud, waste, and abuse in healthcare. To help us unpack this issue, I'm joined now by Abdul Moses, Director of Definitive Risk, also author of Modern Financial Crime Fraud Schemes. Abdul, thank you so much for joining us.
Clement, thank you for having me.
Let's start perhaps at the beginning. When we talk about fraud, waste, and abuse, what exactly are we talking about?
So fraud is the intentional and deliberate misrepresentation of facts for financial gain. So if you can think about your example of getting the doctor's note, it's for your gain to get a day off from work, even though you're getting paid for that. So that's misrepresentation. If you look at waste, it is the incorrect use of those resources in terms of healthcare. Mm-hmm. So I'm not using the resources correctly for quality healthcare services. Abuse is deviating from those healthcare standards. And so abuse would be in that particular field where the practices of healthcare is not complied to.
So who are the main perpetrators of this kind of fraud? Is it the doctors? Is it the members?
So Clement, that's not an easy answer. The reality is that you're going to have actors within the healthcare industry that are meant to be good, but acting bad. And then you're going to have external actors that are bad actors, like organized crime, that has a detrimental effect on healthcare.
Okay, so when you look at just these practices, how common are they in South Africa? Are we seeing them across the board?
So, Clement, unfortunately, what we've seen since 2012 is that organized crime syndicates have infiltrated our healthcare system in South Africa, but also beyond our borders in Africa, and it has cost the country billions of rands. So at this point in time, just from a numbers point of view, organized crime represents one of the largest risks facing healthcare today.
Geez, and what are some of the examples of how these organized crimes is formulated?
So let me give you an example. We all remember the bogus doctors, right? But what they haven't told you is that the bogus doctors are actually operating in syndicates. And so when we talked about the counterfeit foods that we saw that many of the communities were suffering, what they didn't tell you was those counterfeit medicines that were actually entering into South Africa illegally, and that those bogus doctors were actually selling those counterfeit medicines to many of the victims of this type of fraud.
So are medical schemes aware that this is a crisis, and do they even have capacity to deal with this?
So the president got involved, right? And he then created a forum called the Health Sector Anti-Corruption Forum to galvanize the various stakeholders to tackle this problem. So there is a acceptance that it is a crisis. To the second question is whether these schemes are aware, right? Some of the schemes are aware, right? But I don't know whether or not they realize the gravity of the crisis that we're currently in.
And I mean, they would have to realize the gravity of the crisis in order to avoid more wastage. I mean, I can only imagine there's billions of rands that are being lost to these medical aid schemes.
Absolutely, Clement. So what's currently happening is that you'll have all these medical schemes with patient data, doctors' data, company data. And with technology today, a lot of the organized crime syndicates don't necessarily use the old modus operandi any longer.
Yeah.
And that modus operandi meant I steal your actual ID or your bank card. That doesn't have to be anymore. What's happened now with artificial intelligence and cloud computing, I can actually take Clement's digital profile and utilize that illegally without your knowledge and actually claim from the medical aid. Now, if I tell you that that has been done at scale and at volume over the last decade, those numbers would scare you.
Are there consequences for these people?
Currently at this stage, some of the law enforcement has been notified. And the consequences thus far has been some arrests, but there hasn't been actual convictions as yet.
So Abdul, what about counterfeit medicine? How does it fit in all this?
So currently, based on the UNODC research, counterfeit medicines account for more than 250,000 deaths in the SADC region alone. And then if you need to consider that our healthcare system now need to make certain that these patients recover, those ones that hasn't passed on, it costs between $12 million to $44 million per year that it places on our healthcare system. So counterfeit medicines has a dramatic impact on our healthcare, and it certainly drives up the price of our healthcare system.
Abdul, thank you for making time for us.
Thank you, Clement.
Now, it's clear that this is a significant issue between member and schemes, and there are severe consequences for both. We spoke to Lynette Sonepul, who is the General Manager at Southern African Fraud Prevention Service, about the impact of fraud, waste and abuse, and what that impact has on the members and medical schemes. Here's what she had to say.
Lynette Sonepul, General Manager at Southern African Fraud Prevention Services, generally known as SAFPS. Fraud, waste and abuse manifests in everyday healthcare settings. Very often it's ignorant people who may not understand the rules of their medical scheme. They may not understand that the benefits are there for medical purposes. Very often people think, well, you know, it's a grudge purchase, I pay so much every month, so I can use these funds on anything. And unfortunately, there are many healthcare practitioners who think along the same lines. People see it as a grudge purchase, it's a lot of money to pay every month, and very many people think because of that, the funds are available to use as they please. And ultimately, it results in an increase in contributions, which generally has a massive impact on the economy of South Africa. I think the important thing to consider with regard to vulnerable and low-income individuals is, again, people are desperate. They know they've got a medical scheme, they know they've got benefits available to them, but if they're on the breadline and they need food or they need stuff for their babies, there's not much that's going to stand in their way to tempt them to use their medical aid card in exchange for those goods or services. Well, I think it's very important to state at this point in time the impact that fraud, waste and abuse in medical aids has on quite a large circle. And I could say, for instance, the people who work in the medical schemes, myself no longer, but certainly was there for a long time, is that investigators go through a lot of time and effort investigating these matters, getting the credible evidence, putting everything together for a report to Health Professions Council, and it costs money as well. Inevitably, the service providers who are reported to the various councils would either get a fine, and very often we see that they get suspended sentences. I just believe that the law should become tougher with the people who are perpetrating the fraud, waste and abuse. I think vigilance is the responsibility of each of us as a citizen, no matter what we do. But with regard to medical aid, you're paying for that medical aid as a member every month. And we certainly would like to see more vigilance from the medical aid members, as I said before, in that they are aware of what treatment they're receiving, what services have been claimed for. Read your claims, read your medical aid statements, and certainly if you find something unusual there, report it.
We all have the responsibility to be vigilant and report any form of fraud, waste and abuse, because it affects all of us, and often where it hurts the most, our pockets. After the break, we dive deeper into this topic with Dr. Stan Moloabi, Principal Officer at GEMS, who has been passionate about eradicating fraud, waste and abuse within the Government Employees Medical Scheme. Welcome back to the Health Club. In the fight against healthcare fraud, technology is stepping in as a powerful ally, with new tools and systems being used to flag suspicious claims and protect the integrity of healthcare services. Lana Mzansi, we're seeing more innovation, but even the smartest tech can't replace vigilance, especially from you as a member. To bring this closer to home, I'm joined by Dr. Stan Moloabi, the Principal Officer at GEMS, to discuss this further. Mr. Moloabi, thank you so much for joining us.
No, thank you, Clement. It's always an absolute pleasure, Horere. We can discuss these things.
So we've been talking about big picture stuff, and I want us to make it more personal. What are some of the common examples of how members might unknowingly become victims or even perpetrators? I think a lot of us grew up where we see our neighbors or some of our family members for some reason talking about conversations to help someone get a gold tooth, even though for some reason they're not part of the beneficiaries. And when you are growing up, you're not realizing that people are talking about a fraudulent activity there. Is that one of the examples?
Yes, the unknowingly, it's a very interesting one because, as you say, for instance, if I have a medical scheme, I would then say to you, Clement, when you need to go to the doctor, don't worry. You basically I will pay on your behalf. And then let's say the time comes when you need to go to the doctor. Just take you to the doctor. The doctor is not aware that you are not one of the sons, which is a bit, or you are not the husband. Then the person claims against your name, and then maybe there's an arrangement that, it's cash replacement. There's a claim against the medical scheme, and then we pay, and then the person, when the payment comes through, the owner of the medical scheme benefits, and that's fraud.
Yeah.
So that would be unknowingly. Well, there's also a category where a person is colludes with in that case now, the owner of the medical scheme would be knowing, and that's probably another part of what we would have to talk about.
So how do we protect ourselves then as members, and how do you as the schemes also protect yourselves?
Well, as members, firstly, the most important thing is that you should by all means not participate in fraudulent activities. Then from the scheme's perspective, because this problem is there, we monitor the claims. So there are various ways that we are able to see that trend. This member is hopping from one doctor to the other, so that would be a trend that is unusual. We would then check that out and investigate. Or sometimes members, we have a whistleblower line. Members, when they receive claims, and then sometimes it's just a claim pops up, a message comes from the medical scheme that you have seen Dr. So-and-so, and we will be processing their claims. That's when, you basically would have to then report to the scheme that I've got some claims against and in some instances that is what happens.
Yeah. How widespread is this medical aid fraud against GEMS? Earlier this year, there was someone in Limpopo, for instance, that the police arrested who attempted to defraud GEMS. I imagine there are other cases. How widespread is it?
Well, there are other cases, certainly. At the moment, we can basically only estimate. I can give you an estimate, as I had mentioned earlier. We estimate that in South Africa, in general, claims that are fraudulent could be anything between 5 to 15% of what we pay out to healthcare providers. So in the context of GEMS, 5 to 15%, we roll it up to about 10%, it's about 6 billion per annum. That is fraudulent claims. So that's very significant. And then we have in terms of, if we were to say, widespread from the basis of how many people usually get exposed, they differ.
Sure. What do you say to perhaps people watching us who are thinking, well, I'm not affected by that. Yes, I'm a GEMS member. Some people are maybe doing the fraud, but I'm not really affected. Should we be concerned as members of GEMS about this fraud?
Everybody should be concerned. I think we can't say you are not affected just because you are not a participant. If we could reduce the fraud, waste and abuse to a minimum, that would reflect in how the annual contributions are adjusted. So what happens is that if we have to accommodate the fact that there's possibly 10%, it gets factored into what we pay as members of GEMS. And if we can nip that, it will also, be a positive into our pockets as members.
Yeah.
So everybody should be worried if you are aware that there is those type of activities.
Dr. Mulwabi, thank you so much for joining us, and thank you for helping us understand the consequences of this fraud, not just on the medical aid scheme, but on us as members as well.
It's an absolute pleasure as always.
Thank you so much for making time. Now, as you can hear, it's clear fighting healthcare fraud isn't just the job of medical schemes. It starts with each and every one of us. If you ever feel unsure about a medical bill or something just does not feel right with your claim, please do not keep quiet. Fanele ukulume. Contact GEMS or your scheme. Your voice matters. Your action could protect someone else's health tomorrow.
In this edition of GEMS News, we explain how fraud, waste and abuse affect you and how you can report it. Fraud, waste and abuse in healthcare affects all stakeholders in the industry, especially members' pockets and benefits. Examples include false claims, unnecessary treatments or inflated charges, all of which lead to increased costs and reduced benefits for you as a member. As a GEMS member, you can protect yourself by staying alert, carefully reviewing your medical aid statements, and immediately questioning suspicious charges. Report any fraudulent activity anonymously to the GEMS Fraud Hotline on 0800 212 202 or email gems@thehotline.co.za. For more information, visit the GEMS website or get in touch with us through our social media channels.
Remember, go hloka tsebo ke go lahlegelwa ke ditokelo. Staying informed and staying vigilant is the best way to protect your benefits. Thank you for joining us for this crucial conversation. Until next time, hlokomelang, qaphelani, nithathe izinyathelo zokuziphatha kahle kwezempilo. Take care.